Southwest Virginia and Northeast Tennessee suffer from chronic high unemployment, poverty, and a lack of adequate health insurance.
In Tennessee, even with TennCare, over 10% of the folks in this area are uninsured. But in Southwest Virginia, that figure is closer to 25%, which means 1 out of every 4 people in Southwest Virginia is without health care insurance.
Crossroads Medical Mission is a free Christian clinic that provides primary medical services to anyone with difficulty accessing medical care.
Crossroads offers a variety of different services. You can basically consider us your doctor's office on wheels. We can provide the same service that most primary care physicians do provide.
Health care, including medication, is offered at absolutely no cost to patients.
Often, there are additional services that are needed for folks, and Crossroads has been blessed with over 24 specialists and dentists who will take referrals from us, either at no cost or at a minimal cost to our patients.
Our mission basically attempts to reach people without any qualifications whatsoever.
Our target audience are people that are falling through the cracks, that don't have an opportunity to have a regular doctor and get regular care.
No one is ever denied care. On average, between 80 and 90% of patients are uninsured.
There aren't very good options for patients without insurance. I mean, really, they either go without care or they go to an emergency room, or if they go to a practice, almost everywhere, there's an upfront cost, which many can't do.
I'm diabetic, and my blood sugar is where I haven't had insurance since February. My sugar is high, but without insurance, you have to pay everything up front. They won't bill you or work anything out with you where I go. So I just kept trying to find places that would help.
Well, I was supposed to be on 3 different types of meds, and I had to quit taking all 3 meds because I couldn't afford to do it because I couldn't get insurance, and the meds were just too expensive otherwise.
Working in family practices in the area, founding doctors Tim Schwob and Paul Durden were dissatisfied with the medical industry's efforts to reach those without insurance. For years, they discussed ideas for a free Christian medical clinic. Finally, with the sacrifice and generosity of many, the vision for Crossroads was finally realized in 2002. Today, it is the collaboration of many that makes Crossroads effective. We partner with other outreach organizations including homeless shelters, food pantries, community centers, and Christian churches of various denominations. Medical care is particularly suited to the task of mission work.
Medicine is a unique opportunity because people come in with physical issues, but many times at the root of those physical issues is a spiritual problem.
Depression is certainly an issue for a great many of our patients, and that can be highly linked to their spiritual battles that they're dealing with.
I mean, the reality is that there's not a pill for every problem that we have, and sometimes we need help from above.
Christ commands that his followers care for the hungry, thirsty, and sick. As Jesus had joy in the work of the Father, Christians can find joy from the work of the Son.
As a disciple of Christ and in a ministry, a Christian ministry, the greatest blessing for me has been to see the way that he works. It so plainly came through the work of Christ that and anybody who's been involved with it has seen that it's certainly not been our doing, it's been his doing.
Crossroads Medical Mission is a nonprofit organization and is funded primarily by individuals, congregations, grants, foundations, and corporations.
We receive less than 15% of our budget from any type of government sources, and I think that comes as a big surprise to many people.
Because Crossroads does not bill its patients, we must rely completely on support from the community.
It costs around $2,000 a day for us to have our clinic in operation.
Crossroads Medical Mission is ecumenical in operation and receives support from several Christian denominations.
Crossroads welcomes your support, and there are a number of ways that you can support us. You can support us as a volunteer, you can support us with your prayers, you can support us with your financial support, and we are in need of all of those.
No one appreciates your support more than the patients Crossroads serves.
It took a load off my mind just even knowing you know, when I found out about it, that it was here. But I mean, it definitely helps people who, like myself, you know, don't have insurance and would maybe let something go.
I've been diagnosed with depression, anxiety, and a lot of stomach problems, so I'm pretty much miserable without my meds. Until something comes along, until I can get employment to where I can get insurance, or the state comes up with another insurance program, this will be about the only way I can get my meds and get the help that I need.
With your help, Crossroads can continue to have a lasting effect on the lives of those in the Mountain Empire.